Do you suffer with jaw tension or TMJ dysfunction, and you've been told that you need Botox either by your doctor or your dentist in order to be able to heal this problem, and you're wondering if that's a good idea or not for you? That's what we're going to discuss today. So we're going to cover not only what is jaw tension and what's causing it, but also some different treatment options, including some things that you can do at home right now to help eliminate jaw tension. All right, so jaw tension often is called TMJ dysfunction. Your TMJ joint is this joint right here. It's your jaw joint when you open and close. You can feel it moving if you put your finger right in front of your ear. So here's your ear, put your finger right in here, open, close, and you can feel it. You can feel it actually opening and closing. Well, hopefully, if you have TMJ dysfunction, you may not be able to feel it. That's where the problem comes in, friends. All right, so what happens is that that joint either can stop moving because the disc inside of it is causing a problem, or because the muscles around it are tight. So that's when you talk about jaw tension. That's usually what people are talking about. Now, many people don't know that there's actually a disc in that joint, and it's not exactly a disc like you think of in the spine. So you think in between the vertebrae and the spine, there's these kind of big, thick discs in general. This is not the same thing as what we see in the TMJ, even though we call it a disc. It's more like a little flap. It kind of works like a windshield wiper, if that makes any sense, but it helps to lubricate the joint surfaces in the TMJ because there's actually two joint surfaces. That's what makes it a joint. So it helps to keep those two bones from rubbing on each other. Now, how do you know if it's a muscle tension issue or if it's a disc issue? That is a fantastic question and really easy to tell the difference. When it is actually a disc issue, there is a hard stop, is what we call it. So you get to a point of trying to open and it's like, it's hard. And it may be painful, although it's not always painful. More often than not, when it is actually a disc issue in the TMJ, more often than not, there is no pain with it. It's just, I can't open any further than that. Okay. Now, if it's painful, if you feel stretching in the muscles, or even if it starts to give you a headache, more than likely that's actually a jaw tension issue that's causing your TMJ dysfunction. If you have jaw tension in the muscles of the jaw, so usually we're talking about the masseter, that's this one here, and temporalis, so that's this one up in here. If you have tension in those muscles, it can make opening or chewing difficult. It can lead to other problems, which we're going to talk about in just a second. But first, I want to tell you, if you do have tension in the masseter or the temporalis and you get Botox, will it help relieve your jaw tension? Yes, for a little bit. But let's talk about that. What the Botox does, so Botox is botulism toxin, so it is a paralytic. It temporarily paralyzes the muscles. Now, it doesn't paralyze the entire muscle, or else like the jaw could fall off or something like that, but fibers of the muscle that decreases the tone so that it makes it easier to open your mouth and do other functional activities like eating, which is super, super important. However, I don't know if you want to be putting a muscle paralytic into your body. Personally, I don't feel like that's something that I would do, but everybody has to make that decision on their own. What I will say, because I have been asked to by a patient who got Botox, now she didn't get it for a TMJ, she got it for all of her laugh lines. So you can see all my laugh lines. There you go. She got it for her laugh lines and to help smooth out her skin, but she got a bad batch of Botox. So she actually had this like pouch here, and then she had one on each side. And she asked me if I ever talked to anybody about doing Botox injections to report to them what I had seen, that she had these pouches that were there permanently. They were going to be there for the rest of her life. And she regretted getting the Botox. Now, she regretted getting it for what she felt was a vanity reason, and everybody has to make that decision for themselves. However, I wanted to tell you that's what my patient said, and that was her input to you. So I give it to you, and you do with it what you feel correct. Now, if you feel okay putting Botox into your body, will it help decrease muscle tension? Yes. However, it doesn't last forever. They say that Botox usually lasts about 3 months. In my experience, it lasts between 2 to 6 weeks. It depends really on how tight your muscles are. At least that's my thought. Or maybe how much Botox they actually put in. There is different variables and how much they're going to use and where they're going to put it and if they put it in multiple sites and all of that stuff, which is beyond the scope of this video because I can't do it for you anyway, and I don't really understand all that stuff. I'm sure there's other videos out there for that. However, I will tell you in my experience, it usually lasts between 2 to 6 weeks, and then you need to go in and have it done again unless you fix the root problem. This is the important point. If you don't fix the root problem of what caused that jaw tension in the first place or that TMJ dysfunction, the Botox is only a Band-Aid treatment. Now, as I say often, friends, sometimes you need a Band-Aid because that's the only thing that's going to get it through right now. And I understand that. And if that's you, this may be a very viable option for you. However, it is not going to solve this problem. It is going to give you a break of time to find a real solution to that problem because Botox will wear off. If it's 2 weeks, if it's 2 months, if it's 3 months, it's going to wear off eventually. And whatever caused that jaw tension is going to still be in place unless you do something about it. So what causes that TMJ dysfunction or that jaw tension in the first place? Well, if it happened very suddenly, the first thing I'm going to ask a patient about is, have you had any recent dental work? Particularly if you've had any crowns done, cavities, any filing of your teeth, anything like that. If you've had recent dental work, sometimes that can the TMJ can just get irritated. It doesn't necessarily mean that the work was done incorrectly or anything like that. But dude, for me, my TMJ hurts after I just go in for a routine cleaning because they put those dams, I think is what they call them, up in there, and then you're like biting on it and ow, my TMJ hurts and I don't even have TMJ problems. So it could be just that it got irritated by doing the dental work in the first place. So if it's very, very recent and you've never suffered with this before, that would be my thought initially, is to ask you about recent dental work. I will tell you at the end of this video, we're going to cover some things that you can do right now. And if that is you, that you just recently started having TMJ pain, then those tips should be really, really helpful for you. So check out those at the end of this video. Now, more commonly, what we see is that TMJ dysfunction comes over time, and it's usually caused either by clenching, which is often due to stress, or grinding, which again is often due to stress, or heavy chewing. So if you eat a lot of like steak or beef jerky or really fibrous foods and it's really difficult to chew, then that can cause a lot of stress to that TMJ. Again, if it's a more recent thing and it hasn't been bothering you for a long period of time, the tips in this video will work very, very well for you. If this has been going on for a long time and is caused by something like stress, you need to remember these tips will be helpful in the short term, but you need to deal with that root cause. And if stress is the root cause of your TMJ dysfunction or your muscle tension, you're going to have to work on that, friends. I can only give you so many stretches to do, but I will give you some ideas that will help to relieve your pain, which should help decrease your stress a little bit. Okay, so what are you going to do at home for this jaw tension or to relieve your TMJ dysfunction? First thing I'm going to encourage you to do is to start practicing some deep breathing. I have a video here that I will link on how to start with your deep breathing progression. And it is very, very important, particularly if you struggle with TMJ dysfunction. Now, many people will be like, whatever, I'm breathing okay. Please go watch the video. Please learn how to breathe correctly. It is super, super important because if you are not using your diaphragm, which is the big muscle for breathing, it means you will be using the accessory muscles of respiration. These accessory muscles are located up here in your neck and they attach into the cervical spine right behind the TMJ. So it is critically important that you are not overusing these muscles while you're breathing because that can further aggravate jaw tension. The second thing I need you to do is work on your posture. It is super, super important to make sure that the muscles on the back of your neck are not having to work too hard to hold that jaw in place, okay? If you're constantly in this position, and friends, I'm looking at you, if you like to sit on the couch and lean back, and eat your dinner. Okay, I'm looking at you. I'm looking at you. All right. Don't do that. You need to be, especially when you're eating or chewing or anything like that, you want to make sure that your jaw is in a good position. So your head should be over your shoulders should be over your hips, and if you're in standing, your hips should be over your feet. It's very important to make sure that the spine is stacked up correctly to take stress off the muscles in the neck that also affect the TMJ. Now, if you're having a really bad flare-up of your TMJ pain or jaw tension, and it's really, really bothering you and painful, a little bit of ice can be really, really helpful and just calm things down. Now, I'm not expecting you to take a big old ice pack and slap it on the side of your head, but what can be helpful is just taking a little ice cube and wrapping it in a paper towel so like your fingers don't get super cold, and just rubbing it right on that joint. Again, that's right in front of your ear right there. So just rubbing it right there. And again, small joint, just a minute or two. You don't need to do it for that long. By the time it kind of starts dripping down your neck, you can be done and put it to the side. You may want to do that 3 to 5 times a day just to help manage that pain. The next thing I'm going to have you do is some gentle massage, but I don't want you to do massage directly over that joint. Okay, ice you can do directly over that joint. If we're going to massage either the masseter, which is the muscle down here, when you try to clench your teeth, that muscle, that's it. Or the temporalis, which is this muscle up in here. So right on the side of your head is the temporalis. So what you want to do is take 2, maybe 3 fingers, depending on how big your masseter is, apply some light pressure. You can either go up and down like so, or you can go side to side like so. Now this is not a huge muscle, so you don't need to use a lot of pressure. Plus, if you do, it'll probably irritate the TMJ. So very light pressure. You can even do it around in circles, whatever feels good. This should feel good. This should feel like, oh yeah, oh, actually there's a spot right there. Yeah, that feels really good to rub it. Same thing with the temporalis. 2, maybe 3 fingers, light pressure. You can do it, go up and down. You can go side to side, or you can do little circles. Again, finding any spots that feel a little bit tender. Again, not pain, but like, ooh, yeah, that's a good spot. And work on rubbing that out. Now with small muscles, again, we want just a little bit of massage, maybe 1 to 2 minutes at a time. You could do that once per hour. The last thing I'm going to do is give you an exercise that you can do that will actually be more of a stretch for the TMJ or to stretch out those tight muscles, as opposed to an exercise like a strength building exercise. But it can be really helpful, especially if you feel like that TMJ is locked or it's not moving correctly. And what it is, it's called chin jumps. So you're going to start with your normal position, good sitting position, head on top of shoulders, to make sure that everything's in the right position. And then you're going to stick your chin out and back, out and back. Right? I know you look super attractive while you do it, but watch yourself in the mirror the first couple times just to make sure you're doing it right. But the goal is just to stick your jaw out as far as you can, and you should feel a nice stretch through that TMJ. You only want to do 5 reps per hour, okay? Again, this is a very small joint. We don't want to ice it too much. We don't want to massage it too much. We don't want to exercise it too much. So 5 repetitions every hour can really help get things stretched out. All right, what are your TMJ questions? Did you try those? Were they helpful for you? Now, go check out that breathing video.